Welcome to this comprehensive guide on management of care, a high-yield topic for the NCLEX-RN exam. In this video, we'll break down the most frequently tested concepts, strategies, and scenarios you'll encounter. Management of care is all about ensuring safe, effective, and coordinated patient care, making it a cornerstone of nursing practice. We'll cover delegation, prioritization, ethical and legal considerations, and much more. Whether you're a first-time test taker or looking to refresh your knowledge, this session will help you focus on what matters most for exam success. Let's dive in and start with the basics before moving into more complex scenarios. Delegation is a critical skill for registered nurses and is heavily tested on the NCLEX. It involves assigning tasks to the appropriate team members while ensuring patient safety and optimal outcomes. As an RN, you must know what tasks can be delegated to licensed practical nurses, LPNs, and unlicensed assisted personnel, UAPs, and which tasks require your direct attention. Remember, assessment, planning, and evaluation are always the RN's responsibility. We'll explore common delegation scenarios and the decision-making process to help you master this essential topic. Prioritization is another high-yield topic on the NCLEX. Nurses must determine which patients need immediate attention and which interventions can wait. The exam often presents scenarios requiring you to apply frameworks like Maslow's hierarchy of needs, ABCs, airway, breathing, circulation, and safety considerations. Mastering prioritization helps ensure that you provide the most effective care, especially in high-pressure situations. We'll walk through sample questions and discuss strategies for choosing the best answer every time. Ethical and legal principles are foundational in nursing and frequently appear on the NCLEX. You'll need to understand concepts like autonomy, beneficence, non-maleficence, and justice, as well as legal responsibilities such as informed consent, confidentiality, and reporting obligations. The exam may present dilemmas where you must choose the most ethical or legally sound action. We'll review common scenarios and clarify how to apply these principles in practice, ensuring you're prepared for any question that comes your way. Advanced directives and end-of-life care are important aspects of management of care. Nurses must be familiar with living wills, durable power of attorney for healthcare, and do not resuscitate DNR orders. The NCLEX tests your ability to respect patient wishes, communicate effectively with families, and advocate for patients' rights. We'll discuss how to handle these sensitive situations and ensure you're comfortable with the legal and ethical considerations involved. Informed consent is a legal process that ensures patients understand the risks, benefits, and alternatives of proposed treatments. As an RN, you play a key role in verifying that consent has been obtained and that the patient is fully informed. The NCLEX may ask you to identify situations where consent is required or to recognize when a patient is not competent to give consent. We'll review the steps involved and discuss your responsibilities in this process. Protecting patient privacy is a legal and ethical obligation. The Health Insurance Portability and Accountability Act, HIPAA, sets standards for maintaining confidentiality. On the NCLEX, you may encounter questions about sharing patient information, handling records, or responding to requests from family members. We'll clarify what information can be shared with whom, and under what circumstances, so you can confidently answer any confidentiality-related question. Nurses are required to report certain incidents, such as abuse, neglect, or errors in care. Accurate and timely documentation is crucial for legal protection and patient safety. The NCLEX may present scenarios where you must decide what to report and how to document it. We'll discuss mandatory reporting laws, the importance of objective charting, and the steps to take when an incident occurs. Supervision involves overseeing the work of other healthcare team members to ensure safe and effective care. Assignment refers to distributing patient care responsibilities based on staff qualifications and patient needs. The NCLEX tests your ability to assign and supervise appropriately, recognizing when to intervene or provide guidance. We'll review examples of effective supervision and discuss how to handle challenging situations. Effective collaboration with interdisciplinary teams is essential for high-quality patient care. Nurses work alongside physicians, therapists, social workers, and others to develop and implement care plans. The NCLEX may test your understanding of team roles, communication strategies, and conflict resolution. We'll discuss how to foster positive working relationships and ensure everyone is working toward common goals. Patient advocacy means standing up for patients' rights and ensuring their needs are met. Nurses often act as liaisons between patients and the healthcare system, addressing concerns and facilitating access to resources. The NCLEX may present situations where you must advocate for a patient's wishes, safety, or access to care. We'll explore examples of advocacy and discuss strategies for effective communication and support. Resource management involves using time, staff, and materials efficiently to provide optimal care. Nurses must prioritize tasks, delegate appropriately, and avoid waste. The NCLEX may test your ability to manage multiple patients, allocate resources, and respond to shortages. We'll discuss strategies for effective resource management and how to adapt when resources are limited. Disaster and emergency preparedness is a vital component of management of care. Nurses must be ready to respond to mass casualty incidents, natural disasters, or facility emergencies. The NCLEX may present scenarios requiring you to triage patients, implement emergency protocols, or manage limited resources. We'll review key principles of disaster response and discuss how to stay calm and effective under pressure. Triage is the process of sorting patients based on the urgency of their needs. In emergency situations, nurses must quickly assess and prioritize care. The NCLEX may test your ability to identify which patients require immediate intervention and which can safely wait. We'll discuss common triage systems, such as START and the Emergency Severity Index, and provide tips for rapid assessment. Quality improvement (QI) initiatives aim to enhance patient outcomes and safety. Nurses play a key role in identifying areas for improvement, collecting data, and implementing changes. The NCLEX may ask about QI processes, such as root cause analysis or plan to study act cycles. We'll explain how to participate in QI projects and the importance of continuous improvement in healthcare. Risk management involves identifying and minimizing potential hazards to patients and staff. Nurses must be vigilant about infection control, fall prevention, and medication safety. The NCLEX may present scenarios where you must recognize risks and implement safety measures. We'll discuss common risk factors and strategies for maintaining a safe environment. Infection control is a fundamental aspect of patient safety. Nurses must follow standard precautions, use personal protective equipment (PPE), and adhere to hand hygiene protocols. The NCLEX often tests your knowledge of infection control practices and your ability to prevent the spread of disease. We'll review key principles and discuss how to handle infection control challenges in various settings. Medication safety is crucial for preventing errors and ensuring positive patient outcomes. Nurses must follow the 5 rights of medication administration: right patient, right drug, right dose, right route, and right time. The NCLEX may test your ability to identify potential errors, respond to adverse reactions, and educate patients about their medications. We'll discuss strategies for safe medication administration and error prevention. Falls are a common cause of injury in healthcare settings. Nurses must assess fall risk, implement preventive measures, and educate patients and families. The NCLEX may present scenarios where you must identify risk factors or select appropriate interventions. We'll review common fall prevention strategies and discuss how to create a safe environment for all patients. Effective time management is essential for nurses juggling multiple responsibilities. Prioritizing tasks, delegating appropriately, and staying organized help ensure that patient care is delivered efficiently. The NCLEX may test your ability to manage competing demands and avoid burnout. We'll share tips for improving your time management skills and maintaining work-life balance. Conflict can arise in any healthcare setting, whether between staff members or with patients and families. Nurses must use effective communication and problem-solving skills to resolve conflicts and maintain a positive work environment. The NCLEX may present scenarios requiring you to choose the best approach to conflict resolution. We'll discuss common sources of conflict and strategies for addressing them constructively. Patient education is a key responsibility of nurses. Teaching patients about their conditions, medications, and self-care promotes better outcomes and empowers them to take an active role in their health. The NCLEX may test your ability to assess learning needs, provide clear instructions, and evaluate understanding. We'll review effective teaching strategies and discuss how to tailor education to individual patients. Discharge planning ensures that patients have the resources and knowledge they need to continue their care at home. Nurses coordinate with other healthcare providers, arrange follow-up appointments, and provide education on medications and self-care. The NCLEX may test your ability to identify discharge needs and develop appropriate plans. We'll discuss the steps involved in effective discharge planning and how to address common challenges. Continuity of care means providing seamless, coordinated services as patients move between different settings or providers. Nurses play a vital role in communicating information, transferring records, and ensuring that care plans are followed. The NCLEX may test your ability to facilitate transitions and prevent gaps in care. We'll review strategies for maintaining continuity and supporting patients throughout their healthcare journey. Case management involves coordinating care for patients with complex needs, often across multiple providers and settings. Nurses assess needs, develop care plans, and monitor progress. The NCLEX may present scenarios requiring you to identify case management responsibilities or collaborate with other professionals. We'll discuss the role of the nurse case manager and how to ensure effective care coordination. Utilization review is the process of evaluating the necessity and efficiency of healthcare services. Nurses may participate in reviewing patient records, monitoring resource use, and ensuring that care meets established standards. The NCLEX may test your understanding of utilization review and its impact on patient care. We'll explain the process and discuss how nurses contribute to cost-effective, high-quality care. Ongoing education and training are essential for maintaining a competent nursing workforce. Nurses may be responsible for orienting new staff, providing in-service training, or participating in continuing education. The NCLEX may test your ability to identify educational needs and support staff development. We'll discuss strategies for effective staff education and the importance of lifelong learning in nursing. Performance appraisal is the process of evaluating staff performance and providing feedback for improvement. Nurses may participate in peer reviews, self-assessment, or formal evaluations. The NCLEX may test your understanding of appraisal processes and your ability to give constructive feedback. We'll review best practices for performance appraisal and discuss how to support professional growth. Change management involves guiding individuals and teams through transitions in practice, policy, or technology. Nurses must be adaptable and help others adjust to change. The NCLEX may present scenarios requiring you to implement new procedures or address resistance. We'll discuss strategies for successful change management and how to foster a positive attitude toward innovation. Leadership is a key component of management of care. Nurses may use different leadership styles, such as autocratic, democratic, or transformational, depending on the situation. The NCLEX may test your understanding of leadership principles and your ability to choose the most effective style. We'll review common leadership styles and discuss when to use each for optimal team performance. Motivating team members is essential for maintaining morale and achieving goals. Nurses can use recognition, encouragement, and opportunities for professional development to inspire others. The NCLEX may present scenarios where you must address low morale or motivate staff. We'll discuss effective motivation techniques and how to create a positive work environment. Clear and effective communication is vital for safe and efficient patient care. Nurses must communicate with patients, families, and team members using verbal and nonverbal techniques. The NCLEX may test your ability to convey information, listen actively, and resolve misunderstandings. We'll review communication strategies and discuss how to overcome common barriers. SBAR Situation Background Assessment Recommendation is a standardized communication tool used in healthcare. It helps ensure that information is conveyed clearly and efficiently, especially during handoffs or emergencies. The NCLEX may test your ability to use SBAR in various scenarios. We'll explain each component and provide examples of effective SBAR communication. Chain of command is the formal line of authority within a healthcare organization. Nurses must know when and how to escalate concerns or report issues. The NCLEX may present scenarios requiring you to follow the chain of command to resolve conflicts or address safety concerns. We'll discuss the importance of the chain of command and how to use it effectively. Workplace violence is a serious issue in healthcare. Nurses must recognize warning signs, de-escalate situations, and report incidents according to policy. The NCLEX may test your ability to respond to threats or protect yourself and others. We'll review strategies for preventing and managing workplace violence, ensuring a safe environment for all. Cultural competence means providing care that respects patients' diverse backgrounds, beliefs, and values. Nurses must be aware of cultural differences and adapt care accordingly. The NCLEX may test your ability to recognize cultural needs and avoid bias. We'll discuss strategies for delivering culturally competent care and building trust with patients from all backgrounds. Patients have specific rights, including the right to informed consent, privacy, and participation in their care. Nurses must advocate for these rights and educate patients about their responsibilities. The NCLEX may present scenarios where you must protect patient rights or address violations. We'll review key patient rights and discuss how to ensure they are upheld in practice. Ethical dilemmas can arise when there are conflicting values or interests in patient care. Nurses must use ethical frameworks and critical thinking to make sound decisions. The NCLEX may test your ability to resolve ethical issues and advocate for patients. We'll discuss common ethical dilemmas and strategies for making difficult choices. Nurses have a duty to report impaired practice, such as substance abuse or incompetence, to protect patient safety. The NCLEX may present scenarios requiring you to recognize signs of impairment and follow reporting procedures. We'll discuss how to handle these situations professionally and support colleagues in need of help. Understanding your scope of practice is essential for safe and legal nursing care. The NCLEX may test your knowledge of what tasks are within your role and when to seek guidance. We'll review the differences between RNs, LPNs, and UAPs and discuss how to ensure you're practicing within your legal limits. Maintaining professional boundaries is crucial for building trust and protecting both patients and nurses. The NCLEX may test your ability to recognize boundary violations and respond appropriately. We'll discuss examples of boundary issues and strategies for maintaining professionalism in all interactions. Accurate and thorough documentation is essential for legal protection and quality care. Nurses must chart objectively, avoid abbreviations, and document promptly. The NCLEX may test your ability to recognize proper documentation techniques and identify errors. We'll review best practices and discuss how to ensure your records are complete and accurate. Technology plays an increasingly important role in nursing care. Electronic health records, telehealth, and decision support tools can improve efficiency and patient outcomes. The NCLEX may test your ability to use technology safely and effectively. We'll discuss common technologies in nursing and how to integrate them into your practice. Staffing issues such as shortages or skill mix concerns can impact patient care. Nurses must recognize unsafe staffing levels and advocate for appropriate resources. The NCLEX may test your ability to address staffing challenges and ensure patient safety. we'll discuss strategies for managing staffing issues and communicating concerns to leadership. Wrap up, we've covered the most high-yield management of care topics for the NCLE XRN exam. Remember to focus on delegation, prioritization, legal and ethical principles, and effective communication. Practice applying these concepts to different scenarios, and use frameworks like the ABCs and Maslow's hierarchy to guide your decisions. With thorough preparation and a clear understanding of these key areas, you'll be well equipped to succeed on exam day. Good luck on your NCLEX journey.